Depression in patients with Parkinson's disease is a very common complication, and because there are so many overlapping symptoms between major depressive disorder and Parkinson's, you can often miss the diagnosis of depression. There is overlap with major depressive disorder and Parkinson's disease. For example, in affect, both patients with major depressive disorder or Parkinson's disease, they can feel guilty or have worthlessness, even suicidal ideation. They can also have a similar neurovegetative state, such as appetite and weight changes, concentration deficits, insomnia, even hypersomnia, and fatigue. Psychomotor-wise, they even have psychomotor similarities. For example, they both can have bradykinesia, and they both can have mass facies, or blunted emotional expressions. So how can you tell the difference between the two? Well, you can look at their mood, and you can also look at what they lack. I'll explain this a little further. In major depressive disorder, patients usually have a depressed mood, but in Parkinson's disease, their mood is normally neutral. In major depressive disorder, patients normally have anhedonia, so they lack pleasure or interest in things that they used to do or generally the things around them. In Parkinson's disease, there's usually apathy or abulia. There is a lack of motivation to do things. To reiterate, the sadness and deliberate social withdrawal seen in depression is due to anhedonia. You see the patient have difficulty enjoying previously pleasurable activities, and this differs from apathy when you have a decreased motivation to speak or act. Remember that SSRIs are commonly the first-line antidepressants because they have a very favorable adverse profile, and also don't forget to treat with cognitive behavioral therapy as a good appropriate next step.